Hi guys, I'm Caroline Matthews and I am coming to you from Bozeman, Montana, where I have been practicing dental hygiene for the past 12 years. I'm actually currently back in school in pursuit of teaching dental hygiene. And one of the projects that I'm working on right now is something that's super important to me, which is dental hygiene, but specifically the shortage of dental hygienists in Montana. What I want to go over in this project with you is three things: the causes of the shortage, national and local strategies to address the shortage, and interventions that we can all participate in to address the shortage. So first thing I'm going to do is just have you listen to some local dental professionals and what their insight is on the problem. Are you aware of the shortage of dental providers in Montana?
Yes.
Yes, I am.
Yes.
Yes.
I think I'm aware that there is a shortage, but I don't think I know the extent of that shortage.
So what do you believe is the main cause of the shortage?
I believe that when COVID hit, a lot of hygienists retired, and we just haven't been able to pump out hygienists because there's only one hygiene school in the state.
Cost of living.
I think the major reason for the shortage is we have a large influx of people moving into this area or moving into Montana, but we don't have the clinicians coming in at the same rate.
What do you believe would be a suitable solution for the problem?
Probably bringing more education to the area.
Incentivize graduate students to work in rural areas that could help with their loan repayment and make that process not so competitive.
Bringing cost of living down.
I think that Great Falls College has worked really hard on this issue, and they are now accepting 35 from what was 18 when I originally applied to their program. However, I think we do need more schools in the state, and getting one here in Bozeman would be fabulous, just because people who are already living here and going to school here can obviously afford to maintain living here.
All right, so obviously people are aware of the shortage. And even though we're focusing on Montana, it is a nationwide problem. But coming back to Montana, a few things that I just want you to be aware of is, first of all, Montana currently has 970 dental hygienists and is projected to grow 6% by 2030. The projected annual job openings for Montana is 70, but Great Falls College only graduates about 25 to 35 dental hygienists each year. So that is only half of the needed demand. So as a nation, there is a shortage of dental hygienists as the nationwide job growth increases at a rate of 9%, which is much faster than average. So for proper oral health access for all Montanans, dental hygienists need to serve in a public health capacity. So dental hygienists as a national standard need a bachelor's degree in order to work in public health. And again, since we are a rural state, a lot of the areas that face the dental hygiene shortage need to have providers that can work in public health. So with that being said, because a bachelor's is needed, graduates at Great Falls College sometimes have a harder time working in these areas because you don't qualify out of once you graduate. So what we have instead in Montana is what's called a limited access permit. So the limited access permit gives dental hygienists the opportunity to work in public health by using their experience instead of an education, instead of a bachelor's degree. So what's crazy is only 9% of dental hygienists work in public health nationwide. And in Montana, for those who qualify from experience to get their limited access permit, only 9.8% of Montana's licensed dental hygienists hold that endorsement. And of those, only 58 actively use their license in public health. So what that means is only 5% of Montana's dental hygienists are utilizing this endorsement. Okay, so let's expand, right? So Montana has its challenges, but nationwide, again, there is a shortage nationwide. So one of the biggest causes of that is disengagement and exhaustion. Those are the top causes for dental hygienists to leave the practice, whether voluntarily or not. Some interesting statistics show us that 76% of dental hygienists are between the ages of 26 and 55, and that same percentage of hygienists practice for up to 25 years. This research indicates that dental hygienists have a shorter career span than most other professions by nearly 10 years, as compared to those who typically retire between the ages of 62 and 65 and work for nearly 30 to 40 years. So dental hygiene is a physically demanding job and can significantly affect the body that leads to early burnout. Research has shown that 91% of dental hygienists suffer from some sort of musculoskeletal disorder, or MSD, which means they have pain in their neck, shoulders, back, hands, or wrists. And 31.4% of the dental hygiene workforce will retire within the next 5 years or less. And because of all of these issues, 77.2% of dentists report that recruiting and retaining dental hygienists is extremely challenging. So what I'm going to do is I'm going to show you this map here. So this national map shows you the shortages of dental hygienists across the nation. And what's crazy is if you just look at it, how much dark blue there is. And if you do take a closer look, Montana's up in the corner and we are a lot of blue there as well. So I'm going to keep that up there for you to look at while we're talking about this. But then let's factor in COVID-19, right? So COVID-19, pretty much 5% across the board of dental hygienists just left. They just left the practice of dental hygiene because of COVID-19 for various reasons. And as said before, we just don't have the amount of graduates to compensate for the amount of hygienists that are going to be leaving the profession. So that is where a lot of these issues are nationwide. Okay, so now we're going to come back from the nationwide and come back to Montana, right? So most clinics are understaffed. We're already aware of that. What we're finding though, not every practice needs a hygienist, but most offices do. Dentists report needing an average of 0.6 hygienists per practice, while 75% of employers recognize that there is a shortage of hygienists. We saw the national map, so here's going to be the Montana map. And the Montana map is going to show you the areas, again, just focusing on the areas where there is a severe shortage of dental hygienists. So what these areas are called are health provider shortage areas, so HPSAs. And one thing that I do want to point out, so then we'll bring up this other map, is if you look in comparison of where these shortage areas are to where the dental hygiene schools are. So the two nearest schools that we get a lot of employment from is one, the Great Falls College, and two, Sheridan College in Wyoming. So this shows you where those two schools are and their relation to the shortage areas. It's just kind of interesting that they do correlate with the areas that don't need as much access to providers. Okay, so I love statistics. So I'm going to shoot out a bunch of more statistics at you. So first, 72% of dental hygienists working in Montana graduated from high school or obtained their GED in the state. And Montana only has one dental hygiene program at the Great Falls College. And of those who graduated from the program, 89% were employed in Montana, indicating that local graduates are more likely to stay in Montana. But one thing that is coming up that I'm super excited about and hopefully I can be a part of is that there is a satellite program coming to Bozeman. Essentially, we're growing is the idea. But Montana has a lot of barriers. One of the biggest things is just the size of the state, right? So we've got geography, we've got the shortage of workforce, and then we've got housing and childcare. Those are probably the biggest things that Montana faces. Okay, so this next map I'm going to show you shows you more of the specifics as to what each county needs for those health provider shortage areas. Anywhere from, if you'll notice, there is the geography, there's low income, there is Medicaid, a high demand for Medicaid patients, and there's even the Native American populations that need this access. So these are all the areas that we need to address as Montanans. So again, going back to geography. So Montana is a rural state. We've already covered that, but there's only one urban county. Can you guess what it is? So the urban county in Montana is Yellowstone County, which houses Billings. Billings houses 120,000 of Montana's 1.13 million residents. Outside of Billings, the state covers 145,000 square miles and approximately 6.8 people per square mile. Compare that to the most populated state of California, who estimates that they have about 254 people per square mile. We are significantly more spread out. We also are home to 7 American Indian reservations, and these populations are at a higher risk to lower access of dental providers, and they require dental hygienists with a limited access permit to facilitate their care. And 11 to 15% of this population reports more than 5 years since their last dental appointment. So, in order to help these residents of these areas, of these health provider shortage areas, we need to know how to serve them, how to help them. And so again, 84% of people don't plan to get their limited access permit, and 18% don't even know it exists or like what it is. So this is where I just want to let you know that that is something that you should maybe just store in the back of your mind, so that you can help these populations. All right, so as we know, this is a nationwide issue. And so right now we're going to go back to my local dental professionals and hear what they have to say about some of the strategies that are in place right now nationwide to address this shortage. What do you think about the Dental Access Model Act, which allows dental auxiliaries to perform expanded functions like superscaling and periodontal probing?
I feel like this act would allow states like Montana to allow more access for patients to hygiene care and would take the stress off of dental hygienists.
I'm absolutely in no way in favor of this. I believe that it is just a ridiculous idea. What we do as hygienists is very important, and we go through 4 years of school just to be able to do what we do. Assistants have sometimes no schooling, and from what I knew last year when this act was up, when I lobbied against it at the Capitol building with my class, there is not much schooling, if any, required for them to be able to do these things. And I just don't think that it's ethical at all.
I think that can be very problematic because there's a lot of dental assistants that maybe don't have the knowledge about periodontal probing and some of the problems that can occur if you don't know what you're doing.
As an assistant myself, if I was given that responsibility, I would appreciate proper training, and I just don't want to be taken advantage of either. So I would like to be compensated for that skill that I would be obtaining as well.
What do you think of the Dentist and Dental Hygienist Compact that would allow interstate licensure reciprocity for participating states?
That would be very helpful. Make it easier for dental hygienists to move state to state and not have to change their license.
I think this reciprocity process would be marvelous. We actually have a case in our office where our office manager has a dental hygiene license in the state of Minnesota and cannot practice in Montana.
I had a really tough time getting my license to transfer to Maryland because at the time, they did not accept my Western Regional Examination written boards. So while I had the clinical experience to practice there, I actually had to retake the written boards for that state. And that took me like 3 months to get that done. And it cost like $3,000 for just the application fee alone.
Considering that financial burdens cause barriers in the recruitment of dental providers, would you consider working in critical shortage areas to qualify for scholarship and loan repayment initiatives through the National Health Service Corps? Why or why not?
Yes, I would. And in fact, I did. I applied for those programs when in dental school, and due to the competitive nature, I did not get those scholarships, but absolutely I would be willing to do that. Yes.
If that was an opportunity when I graduated, I do think it would have been great incentive for some of my classmates and myself if I didn't already have my schooling paid for. However, since mine was paid for already, I most likely would not have worked in a rural area just because I'm a city girl.
Okay, so let's talk about the Dental Access Model Act. So this is one of those topics that's super controversial within the dental world, right? So we've got the basics are that dental auxiliaries with proper training will be able to increase their skills by doing periodontal probings and supragingival scaling. So dentists, or the American Dental Association, is for the act. This is a solution for them to be able to address the challenges of recruiting employees by providing more care with their existing employees. However, the American Dental Hygienists Association is not for it. They do not approve of it, and their main reasoning is that it's the lack of education. Lack of education and training to perform these services safely and effectively. So this is one thing that Montana currently does not have this act passed, but there are 36 states that do, and it is something that we should be aware of moving forward. Okay, so the Dentist and Dental Hygienist Compact. This is the one that would allow dental providers to cross state lines more fluidly with their current license. So because license requirements vary from state to state, it's super challenging for providers to relocate across state lines. So that's difficult when Montana only has the one dental hygiene program to attract people to move to Montana. So this act allows providers to transfer from state to state with minimal hurdles. The purposes of this compact are to facilitate the interstate practice of dentistry and dental hygiene and improve public access to dentistry and dental hygiene services by providing dentists and dental hygienists licensed in a participating state the ability to practice in participating states in which they are not licensed. So there you go. That is what it is. Again, Montana is not currently participating in this compact, but Montana stakeholders are considering participation. Okay, so then there's a National Health Service Corps. So this one is designed to help address the financial burden that dental providers have out of school, right? So you've got to provide for families, you have the cost of living, and then you have student debt. So the National Health Service Corps is one of those programs available where you can qualify for loan repayment and scholarships to help buffer that burden. So most places nationwide and in Montana, you get paid more working in urban areas instead of rural. So this addresses the need to recruit providers to work in rural communities. The National Health Service Corps serves in over 7,800 health clinics nationwide, providing care to over 18 million patients. The loan repayment program is available for all healthcare providers, including dental hygienists, and in addition to scholarships and loan repayment, they may also provide a living stipend and job opportunities. However, they do require a commitment to receive the benefits through an obligation term. So in exchange for a scholarship, the student agrees to practice primary care in an approved site with a high-need health provider shortage area for a number of years proportionate to how many years they have the scholarship. So what we are finding is that 78% of providers continue their service and 52% continue for up to 15 years beyond their obligation term. So that is a big solution for this problem. However, one of the biggest drawbacks of it is very competitive. It's hard to get, and of the dental professionals that I've talked to, several people have applied and haven't been able to get it. So even though it exists, it's a little tricky to get, but it's worth looking into. Okay, so that's all the data, right? So that's all the nationwide and Montana data, but what's the nitty-gritty part is the interventions, and this is where you guys can actually play a part. So we know what's going on, we know the causes of it all, we know some of the national strategies that are being implemented, but what are interventions that we see? So what I want to compare this to, being dental providers, you work with dentists, you work with patients. And most of the time, this is how the conversation goes, right? So the dentist comes in to talk to your patient about any of the problems that they're having. They've got tooth pain, they've got tooth sensitivity. And the best treatment is a treatment that addresses the cause of that pain and sensitivity. That's what we want to do with this shortage, right? So we want to know what the symptoms are, identify the cause, and come up with a treatment plan to address the cause. So underlying causes need to be addressed, right? So dental hygiene shortages. Symptom 1. Montana faces significant dental provider shortages, especially in rural areas of the state, which need access to public health services. Cause: not enough providers obtain the necessary licenses or endorsements to work in these areas. Treatment: education. Even if a surplus of hygienists were to flood the state, those providers would need to obtain their bachelor's or their limited access permit to work in public health or advanced careers, hence the need for education. Symptom 2. Recruiting and retaining dental hygienists to work in Montana presents another hurdle. Cause: the state has only one dental hygiene school that offers an Associate of Applied Science degree, and financial barriers prevent recruitment. Treatment: advocacy. Advocacy is essential for promoting Bachelor of Science of Dental Hygiene programs, ensuring licensure reciprocity, and recruiting dental professionals by creating dental hygiene schools and pipeline programs in the state, while also addressing affordability efforts for dental professionals in Montana. Symptom 3. Dental hygienists experience shorter career longevities than other professions. Cause: hygienists may face physical, mental, and social challenges which can lead to early burnout. Treatment: self-care. A focus on self-care is intended to help extend the career life of dental hygienists. All right, so let's talk education. So dental hygienists put in a lot of work to get their degree. Most hygienists work about 3 to 4 years to get their degree, depending on which path they pursue. And the reasoning for that is most programs offer an Associate of Applied Sciences, just like the Great Falls College does. But that's because there's only 58 out of the 332 programs in the nation that offer bachelor programs. So the majority of the programs are associate programs. So associate degrees are great for anyone who plans to work clinically, but there's not as much flexibility with an associate degree as there is with a bachelor's degree. So anyone who would even want to consider a career in public health would need to advance their education. All right, so the obvious role of a dental hygienist is to work as a clinician, and that's what you've been practicing in clinics, right? So that's where you're going and working at a private practice, working with patients directly. So are you aware, though, of all the different options that are available, right? So if you look, I have sent you the professional roles of the dental hygienist. So there is a whole list of other things that you can do as a dental hygienist, anywhere from a clinician, right, to public health, which we have been talking a lot about, and researchers and educators and corporate and all sorts of different things. But the thing that I want you to look at is when you're looking at that list is the education requirements needed for each job. So if you're looking at it, a lot of them need more than an associate's degree to complete. So that's just something that I want you to reference. And if you ever consider an advanced career, you may want to look into an advanced education. Okay, so there are essentially two ways to get your advanced education. One, you start from scratch by attending a school that offers a bachelor's of dental hygiene. We're not doing that because you guys are already enrolled in the Great Falls College. So what you could do, should you decide to advance your education, your career, you can attend online bachelor's dental hygiene programs after you graduate. That's currently what I am doing, and I am attending through Wichita State University. It's all online, and you go at your own pace. So there are a lot of different programs that are available if you decide to do that. And then if you want to continue to get like a master's, there are schools that offer masters of dental hygiene. However, if you do pursue a master's, it doesn't have to be in dental hygiene. You can pursue a master's of public health, a master's of science in health administration, and even a master's of education, any type of master's to apply that to these advanced careers that you see on that sheet. And let's be honest, if more school is just not your thing, pay attention to your experience, right? So going back to that limited access permit. So you can get a limited access permit instead of returning to school. To apply, hygienists must have an active dental hygiene license, have practiced at least 2,400 clinical hours, carry liability insurance, and maintain current continuing education credits prior to application and throughout employment. And then the initial fee for your limited access permit is $50. So although as a new graduate, you don't qualify for a limited access permit right away, it's still good to pay attention to the experience that you're gaining so that eventually you could work in public health by putting those hours towards this endorsement. Okay, so advocacy, right? So that's the second treatment to all the symptoms that we have for dental hygiene shortages. And so advocacy is one of those things where it's really important for you to be aware that you have a voice. And sometimes when you're trying to make big changes, it takes a lot of voices, but that doesn't mean your voice is less impactful. So some of the things that it's just really important to be aware of when it comes to advocacy and engaging in advocacy is just to be educated. Educate yourself with all the things that are available out there and the changes that you want to see. Become familiar with local legislators and share the message that you want to be heard and stay engaged. Another form that I've sent to you is a list of government, national and local officials that you can communicate with to advocate for anything that you feel needs change. So if you'll notice on there, there's even the President of the United States. Maybe won't see as much return on your efforts by going directly to him, but still, it goes all the way down from president down to your local dental hygienist association of Montana. So not only do you need to have a list of contact information, right? People to talk to, you have to have something to say. So when you're educated about a topic and you're passionate about it, advocate for your ideas. Some federal and state advocacy topics that could help address dental provider shortages include transitioning from associate to baccalaureate degrees as entry-level programs, advocating for licensure reciprocity, enhancing recruitment efforts by increasing the number of dental hygiene schools within the state, expanding pipeline programs, and exploring options to alleviate the financial burdens facing the workforce. So I briefly want to talk to you about entry-level bachelor degrees versus the associate degrees. One of the biggest draws for me to focus on this is just straight out of graduation that helps fulfill the need for more public health providers. Bachelor dental hygiene students are more likely to be involved in non-private practice careers. And honestly, going back to that paper that we looked at a while ago, it's strictly because you have more flexibility with your degree. So similar to nursing, what's interesting is nursing kind of has been on the same pathway. They've just been ahead of dental hygiene by a few years. So what they did is in 2011, they started an initiative where they were intending to convert associate nursing programs into bachelor programs. Their goal was to reach 80% transition by 2020. So what that does and what they've seen is that those degrees promote high quality and safe healthcare, higher levels of competency, higher levels of preparation and research, and it allows graduates to enter advanced careers and degree programs straight out of graduation. So dental hygiene is one that we can advocate to follow their example, creating our own blueprint to go that direction. All right, so licensure reciprocity. So advocating for this is advocating for that dentist and dental hygienist compact that we've already talked about. So it's already a bill, it's already in effect. We just want Montana to be a part of it, right? So the compact will alleviate workforce challenges in these states and states that join in the future, right? So we want to be one of those states that joins in the future. So you can contact your local legislators and advocate for this compact. So the number one solution for addressing the dental hygiene shortage is more schools. Whenever I talk to anyone about it, that's probably the first thing that gets brought up. So in addition to that, I'd also like to talk about the pipeline programs. So graduates, as we know, are more likely to stay local. So increasing the number of dental hygiene programs could help recruit and retain dental hygienists in Montana. Luckily, we're in the process already because Great Falls College is already starting to look into getting that remote program started in Bozeman. So that's really exciting. But in addition, we want to increase the interest among the youth. So Montana has what's called the Montana Health Occupations Students of America program. So what that does is it helps promote healthcare careers among high school students. So currently there are 25 schools that are participating in this program. Of those 25 schools, there are 600 participants, and of those 600 participants, only 5% are interested in dental. So obviously there's need for support in this area, whether it's through this or through other means. So you could do it on a more state level, like programs such as the Montana Health Occupation Students of America program, or you could also focus local. So you can do career fairs and go talk directly to your local high school students. The biggest point of advocacy is just to get involved, whether big or small. So the Montana Department of Health and Human Services is a great resource. They can steer you in any direction should you find the desire to become an advocate. So advocacy can take the form of large and small efforts and still make an impact. And then there's the affordability efforts, right? So there's local and national strategies. We are already aware of the National Health Service Corps that we've covered, but local affordability efforts include the housing and childcare, right? Those are the two biggest financial burdens that are faced with our current workforce. So it's interesting that I have personally seen that dentists will offer sign-on bonuses. They offer relocation packages. They offer assistance with childcare costs. They have supplemental housing assistance that they offer out of their own pocket when trying to recruit dental hygienists to come work for them. However, these methods may not be sustainable. So that's where things like the National Health Service Corps can help assist with that issue. However, it is super competitive. So that's where local stakeholders are stepping in to try to see where we can kind of fill that gap, right? Taking the burden off of the dental providers and not expecting as much use from the National Health Service Corps. So they are advocating for other loan forgiveness programs, as well as adequate wages and benefits for dental providers. All right. And then finally, self-care, right? So we've got education, we've got advocacy, but you have to advocate for yourself. So that is where you have to make sure you're taking care of yourself physically, mentally, and socially. So your physical health, as we've talked about, 91% of dental hygienists have some sort of musculoskeletal disorder, right? So exercising, stretching, and sports are proven to be the most important in reducing those issues, right? So just like when you talk to your patients about getting them into the habit to floss daily, you have to take that same advice towards you about exercise and stretching. You know how important it is, and you know how hard of a habit it is to create, but it is really important to extend your health. And so we're going to watch some videos. of just some basic exercises that you can do either between patients or with a patient, just to help with your physical health, right? So what I would like you to do is while you're watching these videos, do the exercises. Practice them with them. They're very simple, very short, easy to do. So practice them, follow along, and then you can also have reference there is a form that I've attached that has each exercise detailed out for you.
Pelvic tilt. Downward wrist flex. Standing hip flexion. Chin tuck. Scapular retraction. Upward wrist flex. Hip flexion.
So just remember that whenever you're talking about your physical health, these are some really good things that you can do inside the office. And of course, we want you exercising outside of the office too, because 85% of dental hygienists believe that exercise is the leading source of stress relief, right? They rate it over quiet time, time with loved ones, or even other forms of self-care. So exercise reduces stress, but it's really interesting because stress also reduces exercise. So it was noticed amongst dental hygienists that self-care, including exercise, was lower during times of significant stress. So just think about that. Okay, so in addition to physical health, let's talk mental health, right? So what I have sent you is, if you can find the Dental Hygienist Mental Health Inventory. I'd encourage you to pause the video at this point and just go through these questions and answer these questions before we move forward. Okay, so a group of dental hygienists took this exact same survey as you did, and these are some of the results that they found. Over half of the respondents reported speaking negatively about their work and performing their duties mechanically. However, staggering statistics reveal that over 70% of hygienists feel worn out and weary after work every day, and they require more time to relax and recover. Over 80% of hygienists feel disconnected from their work and feel tired before arriving at work each morning. Although these numbers may portray a negative picture, the positive aspect is that 75% of hygienists claim that they handle the pressure well, and over 90% believe they can manage their workload effectively. So this is where it's really good to keep an ongoing mental health inventory throughout your career so that you know where you stand and recognize things before it gets too bad. So that is where yoga, meditation, massage, those are all self-care practices that support mental well-being. Scholars actually believe that dental hygienists should be aware of their mental health from the onset of their career. So what they recommend is that we should be including stress management courses in dental hygiene curriculum. So what that would do is it would help students manage their stressors, enhance communication skills, and conflict resolution skills. And if that isn't already built into your curriculum, what you can do is you can pursue those skills in classes that you have to take through your continuing ed courses. And all that would do is help you communicate effectively in your future career as a dental hygienist. So we've got physical health and we've got mental health, and what benefits both is social health. So social health gives individuals a sense of belonging, support, challenges become more manageable, And peers offer that support and encouragement through humor and other means. And so it leads to greater job satisfaction and an overall happiness. There's a really interesting study out there right now that was done in 2018, and it's about tennis. So tennis can actually expand your life by 10 years. And not only is it the health benefits of exercise, but it's also the social aspect of the sport that is found to be linked to the greatest longevity of life. So considering that 75% of hygienists retire 10 years before the other average professional, it's worth considering that this social aspect could account for the difference. Although I focus mostly on physical, mental, and social health, I do want to touch on ergonomics. There are so many products out there that emphasize ergonomics. Basically, there are practical implications for further research in this area, and but the ones I want to talk about is posture from clinician chairs and loops. So the studies that I've read show that clinicians who do use saddle chairs tend to show a little less severity in their musculoskeletal disorders because it promotes proper posture. Clinicians who use loops tend to suffer less in the neck and shoulder and the back pain. And even though the studies that I've read are considered to have occurred by chance, it doesn't disprove the fact that these little tweaks, these little minor tweaks, whether it's a chair or loops or posture, could make the difference between enduring your job and enjoying your job. And that's what it's all about, right? We want to enjoy our jobs, and we want to enjoy our jobs for a really long time. So that's what this presentation is all about. We want to provide you with the instruction on the causes of the dental hygiene shortage, the national and local strategies that address the issue, and recognize that potential impact that it has on your future careers. So ultimately, I'd love it if I could encourage students to take an active role in contributing to the interventions that can enhance dental care accessibility to the state of Montana. And that's it. Thank you very much.